Is it normal for your 12-year-old to be feeling joint pain? That's the topic of today's conversation. Hey, what's going on, guys? Dr. Rob here, the Art of Recovery podcast. Welcome back. So I asked the question, is it normal for your 12-year-old to be feeling joint pain? An observation I made this weekend while watching my daughter cheer for her Pee Wee football team was 5 cheerleaders had kinesio tape around their knee. So this struck me as odd because I don't remember ever seeing that on anyone prior to this. And as a physical therapist practicing for 25 years now, or more than that, God, time just flies. I've never seen this many young people with joint pain. So I asked myself, what has changed? Well, one of the observations is simply that the kids are playing a lot more. They're playing year round. When I was coming up, we had off seasons. We didn't play one sport all year round. We played different sports, which requires a lot of different movements of the body. Your body never gets used to, the same old thing. And it was a good break in the routine. There is also the fact that we had an off season, like I said before. So the body got a little bit of rest. Also, this is just my opinion now, but it seems to be that as the generations are going on and technology is really embedded in all of our lives, we're getting weaker as a society. Very little strength training is being done. More people than not are, much more out of shape and unhealthy. And, this is carrying over to our children. So as a parent, would that be, and even if I wasn't a physical therapist, would that be something that I would do for my child in taping the knee? So the answer probably would be, let's assume that I don't have all the knowledge that I have right now. The answer probably would be no, because common sense would tell me that taping the knee or bracing the knee or any joint for that matter would just make it weaker. To me, something is wrong if my 10-year-old or 12-year-old is feeling joint pain. Now, maybe it's just that, they're overworked and, they're not resting the body enough. And you want to try to get your 12-year-old to stop doing something they love. Well, good luck, because that ain't happening. So, I would encourage more rest periods. And, I was always into fitness as a kid growing up. So I would try to encourage some sort of, exercises. Maybe we could resolve it there. This is a trend that I am seeing, and it's definitely alerting me. Female athletes definitely injure their knees more, specifically in the sports like soccer, lacrosse, field hockey, that sort of thing, where they're doing a lot of running and cutting. You definitely see a lot more ACL injuries in this type of demographic. But the kinesio taping, to me, it doesn't seem like it's the proper way to go. And specifically, if you're taping a joint or bracing a joint in the absence of a strengthening program, well, I can definitely tell you that that is the incorrect way to approach solving this problem. This is just going to make the joint weaker. It's going to perform even worse. It disconnects the brain from the joint, so you don't have that brain-body connection. And, it's just going to develop problems in the future. Even if the kinesio tape is successful in getting rid of the joint pain, which in my experience, I don't even use it. Because I've never had success with it. I've always had better success with the manual therapy skills that I have acquired over this long career in applying the proper manual therapy, which corrects any mechanical fault in the joint. And then I go ahead and strengthen that joint. So to me, the kinesio tape is a big waste of time. You do see it a lot. You'll definitely see it in college and pro athletes, but they're using it for a much different reason. And they have, the top guys, strength and conditioning coaches working with them. So just to tape the knee or any other joint is definitely the wrong way to go. You do not want to do that. And if you are doing that, you definitely need to implement a strength training program. And if if you're dealing with a 10-year-old or 11-year-old and you don't want them lifting weights, which I can understand, and I might agree with you there, you want to use body weight. There's nothing wrong with a good body weight strengthening program. No weights involved, very little resistance other than the body weight. There's a massive amount of exercises you can implement for the entire body, and just get your youngster stronger, and that will solve a lot of these problems. You don't need to resort to something like kinesio taping. It just struck me as odd watching these young women walk around the field with tape on their knees, to see 5 of them, maybe one might not have caught my eye. I may have just brushed it off, but I literally counted 5 young girls, all with tape on their knees. To 2 of them didn't even have the tape on correctly. So that goes to show you, it just doesn't need to be done. There's better ways to solve these problems. Counsel your children about, taking rest periods and doing the exercises. Proper warm-ups before practice and before games is crucial. And, if you need help, you could always reach out to me in the links below. I would love to help you out. Sometimes it's just a piece of advice can go a long way. So it's just my 2 cents here of an observation I made this weekend. So you do with it what you will, and I will see you on the next one. Take care.